Hello friends, this is Dr. Massimo Buda from Naples, Italy. In this second part concerning the computer-assisted procedure in implantology, I will show you the surgical session. In the first part, I'd seen that using the data processed by the software, the milling center produced three devices: cam phase, a model with the implants, a surgical guide, and the fixed prosthesis. The laboratory also prepared an occlusal index that allows a correct placement of the surgical guide in the patient's mouth. We placed in reality two straight abutments on the anterior implants and two 30-degree angulated abutments to the distal tilted implants. To parallelize those distal tilted implants and to permit an adequate insertion of the screw-retained prosthesis. To obtain a correct position of the distal MUA abutment that are not anti-rotational, we use two repositioning jig. Temporary cylinders are then applied on the abutments. On these cylinders, finally, it will be fixed and passively relined the pre-built prosthesis. Let's go to the surgical phases. We apply the surgical guide by using the occlusion of the patient with the occlusal index. We fix the surgical guide with three anchor pins. Then we remove the occlusal index and we remove also the soft tissue with the tissue punch. Then we prepare the site of the implant. To the front before. In this case we use a complete set of bars, number 2, number 2.8, number 3, number 3.2, number 3.4, because of the hard tissue of the patient, D1 quality. For that reason we taping also the site. Then we apply the implant that will be set at 35 Newton centimeters by using also a torque manual wrench. We apply the other implants and at the end we take out the implant, the surgical guide. This is the appearance of the tissue after the surgical phases. We apply the abutment to straight in the front area, and to 30-degree angulated in the posterior region by using a repositioning jig. Over this abutment we apply the temporary cylinders and then we apply the fixed prosthesis. The prosthesis is applied by using the occlusion of the patient. We fix the prosthesis over the temporary cylinders by using a light curing composite, and we fix the prosthesis that it screw retained. You close the all of the prosthesis with the temporary composite resin, and the surgical phase is completed. In this way, we finish the surgical phase, and when the dentist removes the surgical template, the soft tissue appears to be similar to that we see at the end of the second surgical section. At this moment, the surgeon applies the fixed prosthesis, having the patient satisfied and relaxed. To conclude, I would like to summarize the advantage of this procedure. With these procedures, it's possible to have an extremely accurate diagnosis, accuracy in the placement of the implants, a decrease in terms of risk when we are dealing with important anatomic structures, sinus or labral nerve. This means safety procedures. We are able to do a mini-invasive surgery and we have less post-operative course, less pain, bleeding, swelling, definitely less complications. All this in less short time, that means less cost and so simplicity for everyone. In this way, we have more comfort and compliance for both dentists and the patient. Thank you very much for your attention, and I hope to meet soon, maybe in Florence. Have a good day.